Hi, everybody. Thank you for joining me, David McManus, Editor-in-Chief of the Cardiovascular Digital Health Journal, for another great conversation sponsored by our journal. This is a session I'm really excited about for several reasons. But joining me today is Mr. Gary Shapiro, who's President and CEO of the Consumer Technology Association. He's also a real futurist and has thought a lot about and written a lot about innovation and technology, including, I believe, a best-selling book called Ninja Future, which is a great title. He's also part of the family. He's married to a physician. His father-in-law is a cardiologist, so he has a unique perspective, which we're really excited to hear about how technology and innovation is working and what he sees as exciting developments in this area in healthcare and what's coming. So Gary, thank you for joining us, and really excited to speak to you today.
Thank you, Dave, and congratulations on helping launch such an important and frankly exciting journal. I think it will help us move to where we all want to go.
Thanks, Gary. So, well, we're really excited again to talk with you and hear some of your thoughts. In particular, as a community of researchers and academics, largely in healthcare, focused on cardiovascular disease, our readers and our contributors are early adopters in many cases of technologies and are excited to hear examples from the consumer side in particular of technologies that are working to reshape how health is delivered, and some views that you might have towards the future. Could you comment and start a bit of a conversation with us about what you see working, where some of the challenges are, and where we're headed?
Well, my organization is a nonprofit based in Washington, D.C., and we represent over 2,000 American technology companies. Not all of them are engaged in healthcare, but this has been the fastest growth area because a lot of them take the basics of a smartphone, if you will, the components, the sensing devices, and they see the possibilities there. And out of that, we've got an incredible array of new sensing technologies, which are actually produced as sensors for pennies a piece because there's hundreds of millions manufactured. And that's allowed innovation to occur in a very important and rapid way with all sorts of ideas flowing. And we see those ideas every year at our annual event, the CES, the biggest business event in the world in Las Vegas. Sadly, this year it'll be totally digital in January, but we'll have a lot on healthcare there. And we give awards to healthcare winners, and we even have CME certification. But what we're seeing more and more is that these devices are going to areas of sensing, which are allowing new purposes, new ways of medication. And now the silver lining of the COVID cloud has been this rapid shift to digital health, to telemedicine, to telework, to everything, teleeducation. But with healthcare especially, there's been so many benefits from this. And we'll see this, and this is to me a permanent change, a permanent shift. I see it where you could see patients just coming in for a checkup. They could get their technical checkup through devices on them or in the home or even in the doctor's office without the doctor being there. And then the doctor can have that face-to-face interaction with the patient by telehealth. It allows you to actually see the patient's expressions, have the intimacy, and have the caregiver right there in the room with the patient, which isn't really being allowed as much now with COVID. So it doesn't require the caregiver to drive as much, and it doesn't require those 2-hour waits in the waiting room, which patients really don't like, and being exposed to other patients, their social distancing. So what we're seeing is a tremendously quick shift. We had the shift before with Apple Watches and Fitbits and things like that. But now we're seeing the growth. We're seeing companies rushing into this area. We're seeing new services provided, and we're seeing great ideas. And we'll get to the point in the future where you'll get into your car or you do something like that, and it will tell you if you're likely to be sick based on the sensing equipment, perhaps in the car, perhaps you're wearing it, or perhaps it's in the environment itself. It's like going to the White House now. When you go into the White House, for example, there's all sorts of equipment is measuring things about you. And I was there once, and a guy was pulled aside because he had taken one of those pills to measure his GI tract that had a little radiation coming out. Well, our environment will help sense how we are. And that information actually will get there. And what manufacturers and innovators do is they have these great ideas. They're partnering obviously with doctors. There's this new There's this new job called CMO. It's not the chief marketing officer, it's the chief medical officer. It's not only because of COVID, it's because of the possibility that this new sensing technology allows us to do and keep track of people with it in a safer environment, in a greener environment.
Wow. You covered a lot of ground there, but one of the things that, completely agree with you that we've seen more innovation in this space in the last year than probably the last several combined. And I do think it's not only COVID that, as you said, there had been work done by groups like yours, by technology companies who sold devices to consumers that had a very different approach to their interactions with the user and in a different pace of development. And they had started working through, using the Apple Heart Study as really a seminal, a pivotal moment where a large consumer manufacturer worked with regulators and health systems and doctors to develop and clear a device as a medical grade device. And whereas before there had been this separation like between church and state, where consumer technology sits over here and medical technology sits over here, now it feels like those are growing closer and closer together. Could you comment a little bit on that? Is that just, am I crazy? Or is there something to that where you've got CMOs getting added to technology companies and you've got health systems and medical companies getting much more user experience oriented, and the two are kind of becoming more and more similar and linked?
Absolutely. And there's so much to what you said in that. So let me unpack a little bit. First of all, there's definitely been a change in our federal government. And I mean that from the Obama administration and the Trump administration, both. And I expect the Biden administration to be very, very friendly towards innovation and towards say, look, we have to look at our own processes. We have to understand that we need to do things differently. We need to do things quicker because there's so much at stake here. We need to have studies in the area. That's why I think your journal is so important, but also like how Apple got that through. That was pretty quick. It was a different approach. Mm-hmm. Apple's a member of ours and they're involved. And there's a lot of barriers we're trying to get rid of as an organization. So one, for example, is privacy. HIPAA is the standard. Even before our devices, some could argue HIPAA is important, but it also has been an impediment to innovation and exchange of information and progress. Mm-hmm. I think we have to keep looking at how we handle privacy. We took it upon ourselves to gather all the manufacturers together in one area and say, what are we going to do about this, like 5 or 6 years ago? And we came upon a voluntary set of privacy principles. They make sense. There's transparency, disclosure, opt-out, no sale of information to consumers. Everyone agreed upon these, and these are standards. And we haven't had the challenges with privacy with wearable devices we've seen in some other technologies, frankly, mm-hmm. Which mm-hmm. has been good. We're also looking at privacy principles and getting them out for consumers. And another area is standards. So we've set a whole bunch of standards. We must be working on about 15, and we've released several. And they measure things so everyone can talk the same language. One of them is the language, for example, of artificial intelligence. We've gotten everyone in the medical community and technology community to just agree on how we talk about artificial intelligence. But beyond that, we've measured things like, what is a step? How do you measure sleep? How do you measure brain activity? How do we agree as an industry with the health community welcome and participating to a standard? Because remember, standards are so important. It's what gets our electricity. It's allowed the highway system. It's allowed the internet itself. And where we don't have standards, let's take electronic medical records, for example, there's a lack of ability to exchange information in a meaningful way. And that's really hindered us. And I think we have to recognize that as a society and start dealing with it. So we're big on voluntary standards. We have due process. We allow people to be involved. And then with a consensus-based system, we move forward because everyone has that same goal of, frankly, keeping people healthier, measuring things in a way, and allowing consumers to make rational decisions when comparing products. So this measures steps and I measure steps. Well, it doesn't, anyone in the family could take different devices and see that, going back years, steps were being measured different. And there's reasons for that even still today about how long someone's stride may be, for example. That's a constant discussion in our family. But there are other things like how you measure heartbeat, heart rate, things like that. And there's so many more that we're working on and doing, which are very important.
Sounds like you're raising the floor also of equality across consumer devices by standardizing to make sure that false claims can't be made, and there's a standard to which consumer devices will be held going forward, which is fantastic. Well, listen.
That's a good point. When for example, once there is a voluntary industry standard, first of all, governments sometimes adopt them.
Right.
But even more significantly, if you're a competitor that does not follow that standard and you
Yeah.
advertise your product is doing something that it really doesn't do according to the accepted standard, then you're at risk of a competitor challenging you, or the Federal Trade Commission challenging you, or a state agency challenging you. It's not something manufacturers want to be at, but it's also, as we get imported products from China, for example, and other places, we have to be very cautious of.
Right. Right. Well, Gary, listen, I'm going to pause here to allow people to ruminate. And we're going to come back. I hope people join us for a second segment. I'm going to kick off by asking you a question about when your wife goes to clinic and sees patients. You mentioned the EHR. What are some of the ways in which consumer technologies might make the caregiver experience a better, smoother, because that's a real challenge, as you mentioned, to work in the current climate of healthcare with some of the tools that we have. So I hope people stick with us, because I think we're in for a treat. So thank you again, Mr. Shapiro, and look forward to talking to you some more in our next segment.
Great.